Well, good afternoon, everybody. Thanks for joining us on what we think was probably a pretty short notice. When the new premium rates came out for the individual market, a tremendous amount of intensity developed. A lot of the rhetoric that we hear going around is not accurate, but clearly there's a large cohort of Minnesotans that are facing really serious tax increases in the individual market, both inside of the exchange at MNsure and outside just in the regular individual market. And we feel an urgency to address that. The Senate last session had a number of proposals to address some of the concerns about MNsure. One of them was a bill offered by Senator Matt Schmidt from Red Wing. And today we are here to tell you that we are going to make a request of the governor. I sent him a letter today that the DFL Senate would like a special session. And if it can be convened before the election, we would like to do it before the election. And we would like the scope of it to be very narrow. We would like to deal with Senator Schmidt's bill. Now, it does need some modifications. We maybe wouldn't do all of it, but we want to focus on the tax credit part, the part that addresses buying down premiums for people in the individual market. So essentially, people's premiums would be capped, which would take all or most of the sting out of the most recent premium increases. And we're hopeful that the House Republicans will agree. It's a pretty easy bill to put together because the framework of it is already in place. Senator Schmidt had the bill in the Senate. Representative Davids had the bill in the House. And it seems like that's where the anxiety lies and what's happening to people's premiums. So we think that's relatively easy to address. I have placed a phone call to the governor and told him that we were going to be having this press conference. And so before the letter, he was aware that we wanted a special session to address this. And he indicated to me that if we could put a deal together with the House Republicans, that he would call a special session just as immediately as the language could be ready. So I'm hopeful that this can actually be done before the election to take some of the anxiety away. People are going to be making decisions about whether they should enroll or not, whether they can afford to. And so the sooner we do this, the better. Senator Laurie.
Thank you, everyone, again, for coming on, as Tom said, short notice. And thank you to Tom, our majority leader, for helping with this. You know, it was about 3 weeks ago that the marketplace for the individual market was revealed. And, you know, we started hearing from people right away, and we were quite disturbed about both the rates and the choices available and the narrowness of some of the networks that some of our people are going to be in. So one of the things that I want to make sure that we express is that this is sort of a one-time solution for 2017 to take the sting out of the rates for individuals, but that we still will be feeling the pressure to find longer-term solutions. What we're proposing here is going to be a one-year fix to help with rates, and then we're going to come back and try to look at some of the choice issues and things like that, but we're going to put that off to have some time to involve all of the stakeholders. You know, the Senate did have a whole slate of proposals that we were proud to carry. We spent hundreds of hours on a task force with the A-team of the healthcare community last interim and had a whole series of recommendations for how to move forward with the healthcare financing in the state of Minnesota. And the Senate proudly carried those recommendations that received an 80% vote from this task force, I think every one of them, into conference committee, where, you know, and none of them really came out of conference committee. We're going to tee those up. We're also, you know, the governor has asked that this task force get reconvened and take a look under the scenario that has evolved since then. It's also important to note that we adjourned in May, and it was in July when Blue Cross Blue Shield pulled out from the individual market and created a much more volatile situation than anyone was expecting. So we've had no time to really work on longer-term solutions. When Blue Cross pulled out, the rest of the market was very nervous about their position in the marketplace. Went in and refiled additional rate increases, negotiated these caps. We came out in 2017 with a marketplace that nobody finds acceptable. We're going to be asking the governor and asking our colleagues across the aisle to agree with us to take some of the sting out of that rate issue and come back in 2017 with just as much importance and just as much weight behind making sure that we do what's needed because this isn't going to fix the 2018 market. We need to recognize that. And so I will leave it at that for today.
Thank you as well from me for coming in and hearing about what we're proposing to do about this very narrow issue of the excessive premium hikes in the individual market. I am really wanting to remind folks today that there's a great deal of misinformation being communicated about MNsure, and confusing, I think, to the public that where the issue is in premium hikes for the insurance products, and that it's not in the Minnesota Insurance Exchange. And I want to thank you because I've noted in the many places where you're reporting that you have tried to separate that MNsure is a website that offers to people information about what products are available and what their prices are, and helps people understand if they have premium tax credits that would allow them to buy down their product. And so all that you've done to try to separate the language that we're not talking about MNsure, we're talking about premiums and premium hikes in the individual market. So separating that is very important. We've given many examples to try to help people understand how different that is. Last time I talked about that the website is like a website for purchasing airline tickets. The website isn't responsible for setting the prices, the airline industry is. And I was thinking about it on my drive up here today, suggestions that we should eliminate MNsure as a solution to premium hikes is like what happens, unfortunately, in healthcare often, and that is that someone goes in and says, I have a real problem with my tooth, my molar on the left side, and they go in for surgery, and the molar on the right side is taken out. And that's what can happen if we aren't very careful to clearly say where is the problem and what needs to be fixed. Because the notion of eliminating MNsure as a solution to this other problem is like taking out the wrong tooth. So I appreciate everything you can do to help us clarify that. The Minnesota Insurance Exchange is continuing to prepare for people to be able to have a better experience in terms of purchasing on the exchange. And it has many other functions, which include helping people, if they're not eligible for public programs, and they discover that by going on the exchange, to make the transition into another product. So those functions are important. We need to continue to do those things for the public, but we don't want to confuse by using that what is the problem is MNsure, the problem is premium hikes in the individual market.
So I think that my colleagues have done a great job. Typically what I would do today is just to kind of point you to this brochure or this piece of literature that just talks about kind of what happened during the session and kind of what the ideas that Senator Lori talked about in terms of solutions and long-term solutions, and then kind of what happened in the House of Representatives. I don't think that that's appropriate. We surely can talk about it. I think what we really want to focus on is what we need to do today to help the folks that are going to have to make some decisions here in the near future. So I do want to refer you to this and to try to, as you guys start to think about how to write your stories and how to tell the story, that we have been thinking about these issues and more short-term and long-term. I don't necessarily want to get bogged down into a finger-pointing game. I don't think that our constituents want us to do it and the electorate wants us to do it. I think what they want us to do is to start giving them some relief, and that's what we hope to do starting today.
Let me just, maybe before we take questions, say one thing we're not interested in. The DFL Senate is not interested in abandoning the state exchange and defaulting to the federal government. I can't think of a time when we've turned something the state does over to the federal government and it's gotten better. When Minnesota made a decision to start the state exchange, there was broad support for it in the state, including our state Chamber of Commerce. Everyone felt that Minnesota could do it better. We've had some bumps in the road, and we will do it better. But defaulting to the federal government hasn't been a success story in any areas that I can think of. And the notion, and people talk about abandoning the whole Affordable Care Act altogether, we just have to remember what it has done for people. If you've got kids, it'll insure them up to the age of 26, takes the lifetime caps off of insurance policies. Those are very, very important provisions to people. And so we don't support that. And we think Minnesota can do it better. And we're going to roll up our sleeves to help. But in the short term, we want a tax credit to buy down premiums for people that are impacted by these large increases.
Senator Bakk, in your conversation with Governor Dayton, tell us what he said and how it might change from what he said a week or two ago about a special session this close to the election would be chaotic.
Well, he indicated to me that I told him that I had had a call with our caucus, a phone call earlier this week on Tuesday, and I told him there are a lot of people that are hearing from a lot of constituents. This is a very serious issue for this cohort of Minnesota families, and that if we could craft a deal, would he join us at the table to put it together, and would he be willing to call a special session? And I got the feeling that he would. But you probably should hear that from him directly. But if you read the governor's op-ed piece this week, he talked about his campaign slogan for a better Minnesota. He means it. He really means it. And he realizes that we're facing a significant crisis here. And to anybody that thinks, well, how are you going to pay for it? And we don't know exactly what it's going to cost, but it may be upwards of $100 million that would ultimately go into the pockets of Minnesota families. And we have resources to do that. The fact that last session collapsed without a tax bill, the tax bill was $460 million. So that money is sitting there. The bonding bill had about $300 million of cash in it. So there's plenty of cash around. We're sitting on a $1.6 billion budget reserve for emergencies. And I think our intent always was it was for economic downturn so we could build a bridge. But certainly this is an economic catastrophe in the lives of these families. So there are a number of ways that this can be paid for, and I'm hoping to have a conversation with the Speaker this afternoon about it.
You mentioned tax bill and the bonding bill. Would you take up tax and bonding bill as well?
I really don't see the urgency of that. I think that bogs down a potential special session to resolve the emergency we really have at hand. I mean, families are having to make decisions whether they're going to enroll or go without insurance and pay the penalty. And I think we have an obligation to address what is really an emergency here, and that really is all we're asking to be considered.
Senator, when we talked to the governor yesterday afternoon at about 2 o'clock, he was still dead set against having a special session before Election Day. I don't know what time you talked to him yesterday, but have you been able to change his mind?
You probably should ask him, but I would, I'm not a gambler, but if I was, I would bet you that if the Speaker and I went over to see the governor and said, we want to do a tax credit to help these people that have these increasing premiums, my bet's on the governor saying yes.
Sir, do you really think, given the partisan divide over the Affordable Care Act, both here and in Washington, that you can really come up with a temporary bipartisan fix for 2017, and then also that the Congress in Washington is going to come up with a fix for the larger Affordable Care Act?
Well, we want to address the immediate emergency that families are feeling, and I think there should be bipartisan support to do that. I don't think that should be at all controversial. A bill's been introduced. Like I say, it needs some modification because of what's happened to premiums, and we probably couldn't find an agreement to do everything in there, but I'd be pretty disappointed if we couldn't find an agreement to put upwards of $100 million of cash in families' pockets to help them buy down insurance premiums, and that's all we're asking to do.
Have you reached out to Speaker Gallup before this?
I will today.
Senator Laurie, can you describe for us the one-time fix, in your words, what you would like to do in the special session? make it as easy to understand for the average Minnesotan? Because nothing about health
Why are you
insurance
asking
is
me to
simple.
do that? I'm the guy with the long sentences. No, this is, as Tom said, it's a refundable tax credit that is used to buy down the premiums. It works similar to the advanced premium tax credit that's available for consumers under 400% of the federal poverty level. This one would apply to people over 400% of the federal poverty level. That's about $64,000 for a couple, about $97,000 for a family of four. That's where you exit the ability to access the federal tax credits to buy down the cost of your monthly premium. What we're saying is there's still families. That's not a wealthy family. And when premiums have risen to the level that they are going to be available in 2017, those families are going to be under a tremendous pressure, and it's going to be a large percentage of their family's budget to meet the needs if we don't step in. And so what we're going to do is continue sort of the framework of the federal tax credits, capping the percentage of income that would need to go toward health insurance premiums at 9.6%, which is where the feds leave off at 400% of federal poverty level.
I need you to clarify here for a second. If you're talking about federal tax credits, people need help paying their premiums on a monthly basis, not a tax credit after April 15th. How would that help them meet that monthly bill?
We need to work out the logistics of this with the agencies and see how we can get this. The cash flow issues are very real, and we're working with the agencies. I've been talking with the governor's staff for, in the agencies for a week now. They're working very hard to try to meet that need as well. We understand that that is one of the things that people are going to need.
Senator, just while staying the logistics for a second, seems like verifying people's income, calculating how much of a tax credit they'd be eligible for based on that income, and then dispersing this money, whether it's in a lump sum or on a periodic basis, seems like that would be a very complicated thing to set up. Is that something that can really be done in the short amount of time remaining before these new premiums are going to start to take effect next year?
I do think that it is something that can be accomplished. We have most all of the variables already considered. Modified adjusted gross income is calculated. The federal tax credits that are available are settled up at the end of the year. I think this one also would be settled up. So to the extent that we were able to do some advance premiums during the course of the year, if that works, or some amount during the year to help the cash flow issue, it would be settled up at the end of the year. And all of these numbers are known at that point. And I do believe that there is a way to mechanically set this up to make it work for Minnesota families.
Make it work immediately. It says in all caps here, immediately make premiums more affordable. Is that possible?
Well, I mean, the premiums will be more affordable. I mean, you might have to budget.
Immediately, though? Immediately more affordable?
Well, let me
Yeah,
try.
I guess that's what we're trying to
Nobody's
do.
premium increases are going to happen until they renew their insurance, and the earliest that's going to happen is the 1st of January. I don't think, this kind of mirrors what we already do with property taxes. We have the circuit breaker program for people. We could easily, in sitting down with the House, let's pick last year's salary and build a tax credit based on what people earned last year, and give them an upfront payment this year. Just have a 1-year lag in it. Those mechanics are relatively easy, I believe, to work out. We've got dozens and dozens and dozens of different kinds of tax credits in law, and so I think the template for what it would look like is already built.
Senator Bakk, are your caucus members feeling a lot of heat on this issue on the campaign trail, and is that one of the reasons you want this special session?
Well, it doesn't have to happen before the election to impact the actual premiums. But I do think it would take some of the anxiety out so that people, when they were making decisions whether they want to enroll or not, or whether they want to just run the risk of going without insurance and paying the federal penalty, this would tell them what it's really going to cost. And the open enrollment starts on November 1st, I believe. So, could we do it after the election? Certainly. And I'm frankly fine with that. But I think for the anxiety for families, the sooner you could do it, the better.
How about anxiety for candidates, if I could? Is it any coincidence that names like Schmidt and Jensen, some of your more vulnerable members, are authors on most of these bills?
Well, they were authors on them last year.
Senator, Do you agree with Governor Dayton's statement that the Affordable Care Act is no longer affordable?
No, no. What we're talking about here in the individual market, which is much larger than, it's 5% of the marketplace. We've got some problems in the individual market for people that can't access the federal tax credit, for people over 400% of the poverty line. That's the cohort where we have a problem. For 95% of people, and for the people that are able to access the tax credits in the exchange, I think the system is working. But we've got, a pretty significant amount of Minnesotans that the premiums are just too high right now as a result of the experience ratings in the individual market. But it's a very small piece of our healthcare pie.
We've heard from a lot of people about the effect of the premiums in the individual market, the 50% increases and how that's hurting family budgets. But another issue is the narrow networks that a lot of people are faced with and the lack of choices, especially in greater Minnesota. Is there anything that can be done for that in the short term, or is that something that's going to have to wait until next year?
That's going to have to be something that's a little bit longer conversation. I am working with some of the stakeholders on things that might be able to be passed early in the 2017 session. But it's going to take some real stakeholder engagement to work through that, and we're not ready to unveil some of those. It's unclear whether we're going to be able to fix that. We have a marketplace established. It's based on, a lot of actuarial work, building product lines, getting those product lines approved with network adequacy and actuarial soundness behind the rates, neither too high nor too low. It's a big piece of work that takes about 6 months. Trying to change networks, trying to add choices is just not something we can do by, January 1st, let alone November 1st, when people are able to start making choices. So there are some things that we might be able to do to try to allow for people, consumers, to continue to access some of the out-of-network providers and provide some financial guardrails for them, and we're exploring those. It's not certain whether we'd be able to do them, but I don't think we could get something like that done within the context of a special session. It'll be too lengthy a conversation. We need to bring too many stakeholders to the table.
Senator Bakk, MNsure estimates that there are 98,000 Minnesotans who make too much money to qualify for these tax credits. Would you agree that for these people, the Affordable Care Act is unaffordable?
No, I don't. I don't. The problem is they're not eligible for the tax credits. It's the poverty level problem. The federal, much of this, probably needs to get fixed at the federal level. It's going to be hard for Minnesota to do this as an island, but we certainly can do something with premiums for these people that are outside of where the federal tax credit is.
Question about the timing of this. You're here today calling for the special session. The rates were announced 3 weeks ago. Republicans for at least 2 weeks have been calling for a special session. You guys didn't immediately agree with those calls, but are here today. What changed and why you're here today?
We didn't dismiss them either. The Senate hasn't spoken on it, but the Senate is a pretty deliberative body. We are, and we built quite a history of not having knee-jerk press conferences. That's why before I have spoken on this, I actually had a call with the caucus on Tuesday so that everyone had a chance to give me input. And broadly across the state, people are hearing from constituents. My neighbor came down the driveway, and he never comes down to talk to me about politics, and he's in the individual market. And he's got 2 children, and he said, Tom, it's not affordable for me. And more of our members have been hearing what's happening to people in the individual marketplace. He's a little self-employed accountant. And so the pressure has been building on the part of constituents contacting their legislators. That is how citizen-represented government is supposed to work. Representatives hear from their constituents, and then we respond. And I could feel when I was on the phone, and this isn't a call that I had because of the health insurance issue. We've had a number of these calls scheduled with the caucus since we adjourned so we can all kind of keep up to speed. And this time what I heard is about, I asked members, what are you hearing about out on the doors as you talk to people? It was clear to me that we're hearing from too many Minnesotans where this is just too big a burden on them. So I asked them, how do you feel about me calling for a special session? How do you feel about me writing a letter to the governor to ask him? And there was not one person that said no. I'm very careful not to get out in front of the caucus. That's why the press release says this is a caucus decision. People feel very strongly that something has to be done for these individuals in this marketplace. And it's relatively easy. I mean, providing a tax credit is, I'm a former tax chair. It's pretty easy to craft this language to make this work. And if people will resist trying to drag ancillary issues in, we can provide, like I say, upwards of $100 million of cash in the hands of families that are impacting these premium increases.
Thank you, guys.
Thank you all.